Hello, you are most welcome, ladies and gentlemen, to Real Impartation Moment on Tuesday Night Anatomy with Daniel Open. Today's section, we continue our journey looking at muscles of facial expression. So there's the second part, and these muscles, they are the lateral group of muscles, or they are the middle group which are going to work on the mouth. So remember that these muscles, all of them will be supplied by some branches of what we call the buccal branch of what we call the facial nerve. This is the buccal branch of the facial nerve. But remember that some of them may be supplied by something like zygomatic branch of the facial nerve. Talking about zygomaticos major and minor. Okay, so without much ado, these muscles mainly, we are going to look at what we call the Risorius muscle. We're also going to look at the zygomaticos major and of course zygomaticos minor. Then of course we will end with some important band point of insertion being what we call modulus. And so without much ado, let's set the ball rolling. So there we are. We begin with the less not quite developed much. It's quite poorly developed, and that muscle, the one I'm showing with the cursor, is known as the Risorius muscle. Okay, it's not also well defined. Now this muscle can be called the laughing muscle. Okay, the laughing muscle. Okay, because it pulls the corners of what we call the lip as one laughs. Okay, and one thing that you have to also know is that it's not having a bony attachment. It's not having a bony attachment. Okay, so what is happening is that it's actually arising from the subcutaneous tissue over the skin of what we call the parotid gland. The parotid gland will be related somewhere here. Therefore, it's going to originate from the subcutaneous tissue over the skin of the parotid gland, and it comes all the way to insert in this thing that we are calling the modulus. Okay, we will see, and this area is actually related to of course the skin and of course the mucosa over here of the the corners of the lip. And therefore, upon contraction, this is the origin, this is the insertion. It will be pulling, okay, the point of insertion laterally. So that is what it's going to do, and it's also something slightly upwards in that kind of movement. But mainly for the upward movement, it will be by the next muscle I'm going to show you. They will be the zygomaticos muscles. I've already told you that their nerve supply will be coming from, of course, the buccal branch of what we call the facial nerve of the facial nerve. So there's the laughing muscle, the Risorius muscle. Now the next muscle on the list that we are going to look at is the one which is placed upwards over here. This is what we call the zygomaticos major muscle, because we know the bone over here is the zygomatic bone. Okay, zygomaticos major muscle. Now frequently this muscle is not well developed, therefore there's that kind of split in there. Therefore when one laughs, when one smiles, actually you may see that kind of dimple created in there. And that is why these kind of zygomaticos muscles may also be referred to as the smiling muscle. Risorius being the laughing muscle, this one may be called the smiling muscle, because when one smiles and there's that defect in here, that dimple in here, you may see that kind of dimple over here. So that's the zygomaticos major muscle, originating from of course the zygomatic prominence over here on the zygomatic bone, comes inframedially, that kind of oblique manner, to insert along where we have the angle of what we call the mandible, of the lip, or of course the corner of the mouth, okay, of the lip, insert actually in the skin, of course, as well as the mucosa over here. Okay, and therefore we said that yes, upon contraction it will be pulling this way, okay, to be pulling the lower the corners of the lip upwards. Okay, then apart from being supplied by of course the buccal branch of what we call the facial nerve, it may also receive some supply from what we call the zygomatic branch of the facial nerve. Okay, so that is what we see. Therefore, because it's having dual innervation, it is of course a hybrid muscle. Okay, so that's zygomaticos major. Now zygomaticos major is complemented by what we call the next muscle, which we find lower, just a bit lower to it. This is zygomaticos major. A bit lower to it, we have what we call the zygomaticos minor muscle. And this zygomaticos minor muscle, yes, just like the zygomaticos major originated from the what we call the zygomatic bone, it will also run inframedially in that oblique manner, okay, to insert along where we have the angle of what we call the mouth. Okay, and that is where we have, of course, the modulus also being here, that whitish thing over here. So that is where the point of insertion is going to be. Similarly, upon contraction, it will be pulling, the corners of the lip, upwards. Okay, as well as, of course, bringing it a bit laterally as well. Just like zygomaticos major, this one is supplied by, of course, the buccal branch of the facial nerve, and even apart from that, it may also receive some, supply from what we call the zygomatic branch of the facial nerve. It means that for zygomaticos major muscle, yes, almost always it is going to be, a hybrid muscle, okay, because to be supplied by both, the buccal as well as zygomatic branches of the facial nerve. But zygomaticos minor may or may not be a hybrid muscle. Okay, if it's going to be only hybrid muscle, if apart from being supplied by, of course, the buccal branch of facial nerve, it is also supplied by, of course, what we call the zygomatic branch of what we call the facial nerve. So these are the three muscles which you find it in the lateral group, or the muscles which are going to work on the middle aspect of what we call the lip or the mouth, and therefore we're going to end with the fact that there is this kind of roughly cone-shaped chiasma of facial muscles, okay, held together by this fibrous tissue over here. That thing is what we call the modulus. And you can see that it's located on lateral aspects, okay, corners of the the mouth, okay, or the angles of the mouth, and therefore it will be very important. Several muscles will be attaching over here, okay, several muscles will be attaching over here. Therefore, upon that kind of contraction pulling on this one, it may produce that kind of facial expression. So it means that muscles of facial expression, most of them are attaching over here, so that upon contraction of the associated muscles, it will help pull or move the mouth. So I hope you find this helpful. These are the lower group, the middle group of muscles, or those muscles which are going to work on the laterally on the lip. I hope you find it helpful. Please, if you've not subscribed to my channel, please do so that in future exciting videos you will not miss out. Have a good night, all of you, and may God richly bless you.